Welcome back to class. Today we will be talking about assisting with the primary physical examination. You can find this information in your book in Chapter 8. So let's briefly talk about the cells. There are three parts of the cells: the plasma membrane, which surrounds the cell; the intercellular environment houses the cytoplasm, which has living materials to carry out cell functions; and the nucleus contains the genetic code of the cell. Each system has a specific unit in it, and each performs a specific function. So we're looking at the body systems now. And I want to make sure that you look at table 8.1 in your book, okay? There's more information about the cells, the organs, the structures, and the functions of each body system there. So it's important that you take a look and take some notes on that. So what is a primary care referral system? The primary care provider treats patients of all ages and provides lifetime health care for families. They also have a referral system, and it's important to understand this referral system because it's something that your patients are going to need help with as well. And it's that most patients are required to have a primary care provider as the gatekeeper in personal health care. And these primary care providers evaluate the patient's total healthcare needs, and they provide personal medical care with one or more fields of medicine. And then they refer out if the patient needs a specialist or any advanced services. So these are the types of primary care providers that you might see. These professionals include family practitioners, pediatricians, internists, obstetricians or gynecologists, and nurse practitioners, NPs, and PAs, the physician's assistants. And we were just talking about the physician's assistants in class last week. So physical examination, and what is your role as a medical assistant? So you are going to prepare the room, you are going to prepare the patient, and you will assist the provider in helping him to find his findings. So preparing the room is something that you really continue to do throughout the day because all equipment should be continually stocked. So when you come in the morning, you should be checking the stock and making sure everything looks good. Throughout the day, if you notice something is going low, you're replacing that. And of course, at the end of your shift, you're checking all of the areas to make sure it's stocked for the next day. You're also checking expiration dates, and if any material is expired, you need to make sure that that's discarded immediately. We've talked a lot about room privacy, and we want to make sure that the patient is comfortable and in a private room that's well lit and a good temperature. Have you ever been to any kind of office and the temperature is very cold and you're freezing and you don't have a sweater? How does that make you feel? You're feeling a little bit uncomfortable and all you can think about is being cold, right? We have been practicing this and making sure that we do this with everything we do in lab. We need to clean and disinfect the room between patients. This helps to avoid infection. We make sure the drapes, sheets, and gowns are ready to use, arrange equipment for easy access, and always, always, always observe our standard precautions. We want to make sure that the medical record is complete and all consent forms are signed prior. You make sure that you introduce yourself and address patient by their preferred name. Verify accuracy of insurance information by office policy. A lot of times in the office, this is done up front in the front office, and then you don't have to worry about it in the clinical setting. But in some smaller offices, you are responsible for this as well. You will be obtaining specimens that are pre-ordered, and of course measuring height, body mass index, and vital signs. And the way you're assisting the provider, you can be handing them equipment and supplies. You also might be moving the lamp and altering it so that the provider can see in better positions. You will continually be positioning the drapes during the phases of the examination to help with the privacy of the patient, and collect and properly label all specimens. You will also perform follow-up diagnostic procedures as needed, such as EKGs, or if there's a strep test ordered, or a urinary screening. Any of those you would be responsible for helping with. So here are some supplies and instruments needed in an examination. And these instruments are not always used for every examination. It will depend on what type of general examination the provider is doing. So it's important to, again, take notes and really observe when you're training what your physician likes and how they like it set up. Every physician is a little bit different. So it's really nice when you step in there right away, you're critically thinking, you're observing, you're taking notes on the physician and what they prefer so that that room is ready to go and set up like they prefer. So here are some supplies that we saw in that last image. So we have an ophthalmoscope, a tongue depressor, an otoscope, a tuning fork, tape measure, stethoscope, reflex hammer, gloves, and there were some additional supplies such as the lubricant. Now we'll be going over all of those in lab this week and talking more in depth about what their roles are in the examination. So I'll have you go ahead and make sure that you read the book in that area and take some notes so that we can get going on utilizing all of those supplies. Body mechanics. This should be used when you're sitting or standing, lifting or carrying objects, pushing and pulling, when you're transferring patients. It's very, very important. It's used to protect yourself and your patients, just like your barriers are used to protect yourself and patients. So you need to use it consistently in your work environment, and proper alignment begins with your good posture. Make sure that when you're reaching for objects, you don't twist or turn, and make sure to turn your feet towards that object and then move your feet back. Don't sit with your legs crossed. Why do you think this is listed? Well, if you were thinking because blood flow and cutting that off when you're sitting so often, that would be one important reason not to sit with your legs crossed. So you can see that there are many principles of body mechanics, and I'd like you to really focus on looking at these principles. You'll see safe lifting techniques. So you always get help if the load is too heavy. You maintain correct body alignment with the legs spread apart for a broad base, and we'll be practicing this in class. That broad base gives you a lot of support. Do not reach for items. Clear barriers out of the way and get as close as possible to what needs to be lifted. Bend at the knees with the feet, shoulders width apart, and keep the back straight. Use the major muscle groups of the arms and legs rather than the weaker ones of the back. So it's really important. We're bending at the knees, we're taking it, and we're using those strong muscles so that we don't injure our back. When we're carrying a heavy item, make sure that the weight is as close to the body as possible, and you can see that demonstrated in figure 8-6. Move the feet in the direction of the lift. Again, do not twist or turn, because this is the fastest way to cause a back injury. Make sure you bend the knees while keeping the back straight when lowering the item down at the completion of the lift, And if possible, slide, roll, or push a heavy item rather than actually lifting it. So here's those figures. So you can see as she's lifting the box, you can tell what the figures are demonstrating there. So A and B show the proper and improper ways to lift something. So make sure that you're looking at the demonstration. You can see there that in A, she's bent the knees, shoulder width apart, using those arms, keeping it close to her body. And in B, not bending the knees, really going to pull up and lift with that back. And then as she's carrying it, you can see that the box is away from the body. So transferring a patient, and in the ambulatory care setting, depending on the office that you're in, will depend on how often you are responsible for transferring a patient. You want to make sure when you're transferring that you focus on correct body mechanics, that you make sure to provide support on the patient's strong side. You keep one hand under the axillary region and one on the forearm. Always, always bend at the knees and ensure that the patient is safely positioned and safe before you stop assisting them. And sometimes we will also use a gait belt when we're transferring a patient. We'll talk more about that. You'll notice in this, she's transferring the patient utilizing the wheelchair. And it's important in this figure to note that the wheelchair is at a 45-degree angle at the end of the examination table. So how do you move a patient in a wheelchair? If the patient is in a wheelchair, you move the chair close to the examination table. You must lock the wheels and lift the footrest so that that patient can get out of the wheelchair. And then you want to make sure that you are giving them support. Again, in this case, it's very good to use a transfer belt in order to go ahead and transfer that patient. You can also use a method where you put the arms underneath the axillary area and do a 1, 2, 3 count, and we'll talk more about that. Draping the patient. We've seen this already in practicing in lab, and we've talked about patients' comfort and how we want them to feel. And that is what draping is really about, making them feel comfortable and respecting their privacy. So position the sheet so that it allows complete visibility for the examiner to conduct the examination, but only expose the portion of the body one at a time as that examination is going on. So let me give you an example of this. If you are assisting with a breast examination and the patient is laying, you can drape so that the left breast is visible for that examination, and then go ahead and recover with that drape, and then go ahead and open up for the right breast to be examined, then cover completely as soon as that's finished. So that would be an example of draping and keeping it visible only for the time needed. Positioning the patients. So there are several different positions, and these positions are important depending on the type of exam that the physician or provider will be doing. So these are Fowler's position, semi-Fowler's position, supine. We also call this horizontal recumbent. We have dorsal recumbent, lithotomy, and Sims. And what you need to know about these positions is how to position the patient, and also what times are these different positions used and in what exams, so that you can have that patient prepared for the physician before the physician comes into the room. We also have prone position and knee chest position. Trendelenburg position is rarely used in the ambulatory care setting. It's typically used more in the acute care setting, but it is used if a patient has severe